Okay, so as a disclosure, again, no pharmaceutical company was involved in the preparation of this module, that I am a practicing psychiatrist whose work is done online. So most of the stories that you will hear are also stories shared by my patients. I am an educator teaching medical students and psychiatry residents in training, and that just like some of you, I am also a parent with 3 boys going through online learning, and that I am a mental health advocate who misses the old ways of living, no? So I am also not spared, no, of having all these emotional reactions, no, but striving to be happy, no? So I will tell you how we can strive to be happy in this particularly difficult situation. So for this morning, we'll discuss the concepts of stress, understanding its impact on the mental health, and then focus on the COVID-19 pandemic, no, and how it is stressing us out further, and then enhancing one's resilience, no, for a healthier mindset and attitude, and then of course, no, identifying warning signs, no, for mental health concerns. Okay, by definition, Hans Selye, no, describes stress as a state of psychological and physiological imbalance resulting from a disparity between the situational demand and the individual's ability and motivation to meet those needs. So in other words, no, anything that disrupts your flow, no, that disrupts your equilibrium can be considered as stress, no? As basic as waking up, you realize, no, that your internet connection is not as fast as expected. That's a form of stress, no? And as huge as losing a loved one or knowing that a loved one, no, was recently diagnosed with COVID-19. As such, stress is something that we really have to live with. Okay, people will always tell me, Doctora, I don't want stress. I want to avoid it. Lo and behold, no, stress is the rate of all wear and tear caused by life, meaning so long as we are alive, we will continue to encounter stress. It's a matter of enhancing our abilities to cope with it. Okay. Therefore, looking into all these factors, where are the stresses coming from? No, of course, because we are individuals, no, we are definitely affected by our own circumstances, family concerns, financial situations, and our own individual personalities. If you notice, no, there are types of people who are not easily anxious, who are easily worried compared to others. No, if you notice in your group, merong kayong classmates who are far more chill, no, in your term than the others. That's because of the personality differences. Because we are humans, we live with other people, and we are part of an organization, no, organizational demands, no, the task either as a student, no, as a daughter, will also create certain stresses. Our leadership roles that we take into consideration, and the life stages of the organization that we are into, no. If you are the president of the class, probably you have higher stress levels compared to the member of the class, no. You just imagine, no, nowadays, during my time, if I am the president of the class, I just have to make sure, no, that people are here in my class, no. But now, online learning, you have to tell your classmates, please log in because mom is already looking for you, no. So it also causes certain, no. And of course, there is an environmental factor, no. Our economy is one, the political environment, which will definitely put a strain to our mental health in the succeeding days, no, will definitely be an important factor. And of course, the technology, no, because we have access to information, both good and bad, no. That is why it causes a certain level of stress. Note also that stress does not only come from negative life events. Okay, stress can also come from positive life events such as being promoted, no, to a certain level, or going up a certain ladder. No, for example, if you used to be grade 6, no, and now you are now grade 7, of course you note, no, you expect, no, that there will be more challenges ahead, no. Otherwise, kung same lang yung difficulty, wala yung significant improvement. Okay. And of course, why do we have differences in the way we perceive stress? This is because of, number one, our own perceptions of stress. What is stressful for you may not be stressful for me. Okay? Our own experiences with the said stressor, no, pwede rin magkakaiba, no. I may have, for example, no, if you have a very bad, no, experience, no, about your parents' separation, of course that will also affect the way you see fighting, no. You will see that when people argue, no, you will not feel good about it, but there are also some other students, no, who will see that, you know, giving some exchanges of opinion is really not a very bad way of dealing with conflicts. Okay, of course, important to have your social support and the locus of control that we have, no. There are a lot of, especially for students, for teenagers, they feel that they don't have any control of certain things, no. All of us, no, can control our own circumstances at some point in time, no. So no one is helpless, completely helpless about the situation. I always believe, no, and you have to remember that you will always have the capacity to take control of the circumstances that you are in. Okay, that is the reason why we have varying levels of tolerance for stress. Okay, and our experience stress can also be expressed in various ways. Physiologically, some of us can complain of headaches, elevated blood pressures, no, and heart diseases because of what we are going through. That is why, no, if you have parents, no, if you have children who are often complaining of pains, and then when you bring them to your pediatricians, they don't seem to understand what is wrong, then that child may be exhibiting symptoms of stress. It can also be psychological in the form of anxiety, depression, or in our case, who are part of the workforce, less job satisfaction, or behavioral symptoms such as a loss of productivity, absenteeism, no, and and high turnover rates. Okay, let me introduce you to another concept, burnout. Okay, burnout is a very old concept, and it predominantly deals about a job dissatisfaction precipitated by work-related stress, wherein an individual is in a state of emotional, mental, and physical exhaustion caused by long-term involvement in emotionally demanding situations. No? Note that it is physically, mentally, and emotionally draining, but this time around, no, the stresses are long-term already, no, because the idea with stress is that it affects your equilibrium, no, it keeps the balance, but the idea is you will be able to put back the balance again. Okay, that is how stress should be managed. However, no, if left unattended and you feel like you have a difficult time, no, handling your stress, it can proceed to burnout. Okay, so in the classification, burnout is not a mental disorder, rather it's an occupational phenomenon, no? So pag sinabi po nating occupational phenomenon, hindi lang naman yan limited sa nagtatrabaho. It is limited to the roles that we play. I can have a burnout as a parent, I can have a burnout, no, as a daughter, and I can burn out as a student, no, especially in this difficult situation. I can also burn out, no, as a mental health practitioner, no? So in whatever occupation we have, no, that can happen to any of us. Okay, and it is characterized by 3 dimensions. One is that you feel so exhausted. No? Ang daming ganon, di ba? I am too tired to do anything. And of course, once you feel tired to do anything, there is now an increasing mental distance from one's job or occupation, therefore producing a reduced efficacy. No? So of course, no, just like a car, 'di ba? At some point a car needs to be refueled, no? So ganun din po tayo, no? So think of it as you just going through the motions of life, no? And going on despite the challenges, eventually you will feel exhausted. So what is the difference between stress and burnout? Okay? Stress is the initial reaction, no? Kung kaya't pag tayo po'y stressed, no, the emotions are overactive, no? We feel the palpitations, you feel a sense of urgency, no? You feel hyperactive because you wanted to finish the task. Okay? After finishing the task, no, because you have a burst of energy, there is now a corresponding loss of energy. And if you are frequently reacting like that, anxiety disorders may actually be an important consequence, no? But primarily the damage is physical, no? So mas madaling mapagod. Okay? However, burnout is different, no? Kasi this is unattended, no, stress. Therefore, because you are already too tired, no, nauubos na, no, kasi kaya nga burnout it's like a candle, no, that you are already poorly lighting the room. Therefore, there is a sense of disengagement, and that there is now a feeling of apathy. I cannot do it anymore, no? I give up, no? Yan ho yung karaniwang sinasabi ng mga bata when they are signing in, no? Therefore, if you are already tired, no, you do not get to have a lot of motivation to do anything, and then depression may set in because you realize, no, and you might think that you yourself is incompetent to do anything. That is the reason why the damage is primarily emotional. Okay. Therefore, who are the people who are at risk for burnout? Okay. What are the factors that make us burn out faster than others? So you look into these 4 factors: work-related, lifestyle, socio-political or socio-cultural, and the personality traits. Okay. Let's look first into the work-related factors, or in your case, no, the job related or occupational related factors. Having little or no control over work, no. If you have a job, no, that of course now it's quite difficult, no, to control a job because of the circumstances also that we are in, no. Even the government, no, does not help kasi yung announcement of what will happen, no, to the quarantine classification is also poorly done, no. That is why, no, I tell the students, no, I try to make sure, no, that at the beginning of the work, no, my students know what is expected, no. Therefore, that is one way of giving them the control, no. Give them a schedule ahead of time so that they can work on it, no. Hindi po pwede yung pabago-bago, no. Naisip mo parang maganda yung ganitong activity. So bukas siguro 3 days after, no, they can submit. You don't do that, no, because you have to remember that people also need to plan ahead, no. Lack of recognition or reward for good work. Of course, we burn out if we feel that we lack the validation that we deserve. That is the reason why, in whatever capacity, please be generous with your praises, no. As basic as good job anak, no, for going through online classes without any tantrums, no. Hindi po yung good job anak because you had a perfect work. Hindi po ganon, no. But yun kasi yung nangyayari, no. We were so focused with perfection, no. But you know, it's really the learning process that is very important. Okay, unclear or overly demanding job expectations, no? So you have to be clear, no? Kasi when you scold them for getting low grades, no? Ano yung ini-scold mo? Yun bang low grades or yung not doing his or her best? So you have to be careful, no? So I always tell my child, "Are you happy?" "Ma'am, I got a B." No? Siya yung naiinis, "I got a B." Why? Why is your reaction like that? Okay? No? Because ma'am, do you feel you did your best? Oh, yes po. Then you should be happy because you were able to do your best, no? Because it doesn't matter, no, the grades, not so long as they feel that they have done their best, no, then that's good enough. Doing work that is monotonous or challenging, no, that is also a source of burnout, no. For some of the students, especially those who are far advanced, no, medyo difficult yung online learning for some of them kasi yung challenges, no, medyo nabawasan, no, because even DepEd has to sort out, no, and limit some of the activities. Okay. And of course, working in a chaotic or high pressure environment, no, where rules changes from time to time, no, at a whim will definitely cause a burnout. How about lifestyle? Poor sleep, no? Nowadays, this is a common problem, no? Because the world no longer sleeps, it's really up to you, no, to take time to sleep. Working too much without enough time for socialization or relaxing, no? Remember, what is your purpose for working? No, you work for your family. Therefore, no, family time should never be sacrificed, no? Same as having close and supportive relationships, no? If you are only limited to one task, definitely it will burn you out faster, no? And taking on too many responsibilities without help from others, no? It's very important, no, to let the people know, especially in the household, mothers, okay? It is not true, no, that you cannot assign tasks to your children just because they are busy with other tasks, no? If you are too burdened also with responsibilities, then you have to let the people know. Okay? How about socio-cultural factors? Of course, if we have unrealistic expectations, no, the work culture and the funding pressures, definitely that is a cause for burnout. Looking into personality traits, this is very important. People who have a compulsive, obsessive compulsive traits, ones who tend to be perfectionists, those who need control and reluctant to delegate are the ones easiest to burn out, no? Bakit? Kasi, no, masyadong binabantayan, no, ang mga bagay-bagay, no? And you have to realize, no, that you have to allow people to help you with whatever you're doing. Pessimism, no, is also something, no? When you have that, then you will have a tendency to burn out faster. And those who are high achieving and very competitive individuals also burn out faster. Why? Because everywhere they go, no, they are always in a competition mode, no? So you have to remember, there's nothing wrong with being achievers, no? Just make sure that your achiever, no, that your child enjoys the process, no, and not just aspire, no, and not just aspires to be the top one all the time, no, hindi ganon, no. If for example, no, he or she is doing his best and enjoying the process, well and good, no. Pero kung ang purpose lang ay dahil gusto kong mag top one because I will be validated by my parents, no, then that child, no, will burn out faster than the rest. Okay? How about burnout and depression? How do I know if I'm just burned out or having depression? As we say, burnout is characterized by physical exhaustion, cynicism, and inefficacy at work, which is limited, no, to your own occupational status, no? So meaning kung saan ka lamang po napapagod na role, doon lang magma-manifest yung symptoms, no? If you are burned out as a parent, probably enjoying, no, other activities with your friends will be helpful for you. On the other hand, no, symptoms of depression such as reflected in these slides together with suicidality or the desire to end your life, as well as the sadness, no, affecting the rest of your roles, no, social interactions, enjoyment of previously pleasurable activities, no, if those become affected, then we can say that the experience that you have is now crossing over to depression. Okay? So mas malaki po yung nagiging impact, no? Mas malaki yung naaapektuhan ng depression compared to the burnout. Okay? And what happens if we are burned out, no? Sabi nga natin, because we are exhausted, no? What do you do when your gadget refuses to restart? 'Di ba? All you have to do is reboot. Kaya nga almost everything will work again if you unplug it for a few minutes, including you. So do not hesitate, no, to give yourself time off if you feel that you are burned out with a task. However, why do I feel that I easily burn out during this COVID-19 pandemic? No, parang before, no, it was quite easy for me to do these tasks. How come, no? It takes a longer effort, a greater effort on my part to accomplish my task. Okay, because we were introduced to various new normal concepts, such as the shift to distance learning. No? It changed the context of schooling kasi sanay po tayo, 'di ba, with the face-to-face interaction and allowing the teachers to serve, no, as our own external locus of control. Now, both the parents and the children have to adapt, no, to this style of learning, and the educators also had to rethink their strategy, no. Sa totoo po, no, if students say, no, na sila po ay napagod with this online learning, tanungin mo ang teachers, no, doble po ang hirap on the part of the teacher to actually adapt to the online learning kasi we had to learn, no, various learning materials, no, yung mga LMS na sinasabi, we had to train for that. At the same time, we had to also change the context of how we give out, no, our own lectures kasi hindi sasapat yung lectures alone, no. That is why we are all adjusting to it. Okay, and it also presents unusual challenges, no, to most of us, lalong-lalo na po, no, to parents of children with special needs or behavioral difficulties, no. You imagine, how do you teach an ADHD, a patient with ADHD, no, to go through distance learning, no? So yun yung mga challenges that they have been exposed with, okay? Therefore, we are all adapting to it. That is the reason why we burn out faster than usual. But not only that, there is also the shift ng work from home experience. What does it bring to us? Balancing and managing responsibilities. Before, it was clear, no? When you are at home, you are a mother. Now, when you are at home, you are also an employee. So coursework, social lives, family relationships happen all at once. There is also a blurring of boundaries between work and home. Diba? At some point, while you are teaching, sabi ng isang pasyente ko, haba pong ma'am doktora nagtuturo si ma'am, naririnig po namin tumutunog yung pressure cooker niya, no? So there's a tendency for us not to multitask, no? And you also do multiple roles, no? Aside from being a mother, ang sabi namin mothers, no, may lokohan kami in our friends, no, na yung mothers while they are at home seems to be the counterpart of a concierge in the mall, no. Mami, nasan yung notebook ko? Mami, nasaan yung ganito ko, no? Everything relies on the mom, no? And this is happening while the mommy is also working, no? Sometimes, and that does not spare even me, no? Sometimes I have clinic, no, and I can hear my children fighting outside the room, no? Of course, that can create differences, no? That definitely will make the work more difficult for us. And there is also the experience of fear, loss, social isolation, and incomplete grief. Who among us have not experienced of or has not known somebody who has lost a loved one? No, definitely this pandemic altered the experiences of loss, grief, and bereavement. No? Loss is a risk factor for depression, anxiety, and post-traumatic disorder. And nowadays po, we are getting a lot of complicated grief, no, in our own clinics, no. Dati po, ang bereavement, no, ay tinutulungan lamang namin sila, no, by giving them the supportive therapy that they need. Now, even bereavement, we had to give them medications already kasi ho, mas mahirap kung i-handle ang loss, no? When you go to a wake, no, ang hirap not to give them a hug because circumstances tell us not to do so, no? Ilan sa atin ang who would have wanted, no, to go to a wake, no? But our own fears, no, for our immunocompromised family members get the better of us, no. That is the reason why difficult are ang circumstances every day. Okay, but no, surprisingly, not all of us are seen in the clinics. That is because of the resilience, no. Sabi nga natin, resilience is one's capacity to bounce back from difficult experiences. All of us have our own resilience, no. It's just that we vary depending on how we were raised, no, or our own experiences. And why do we want resilient people? Because individuals higher in resiliency are viewed as better able to rebound from negative life or work-related events. Okay. When you look into my proposal on how you enhance resilience, no, I will not reinvent the wheel, but I will just remind you of the things, no, that we should be doing even from day one, even at the pre-pandemic times. Okay. The first one being investing in self-care. Okay. All of us, no, child, teenager, a mother, a young adult, in whatever stage of life, we need to invest in self-care. Because when you take care of yourself, you have better ability to take care of the people around you. No? If you notice po, actually, children are far resilient, no, than you give them credit for. No? Therefore, be mindful, especially for adults, of your own emotional state. Kasi po minsan, nauuna pa pong mag-adapt ang bata sa inyo. It's just that yung emotional burden ay na-unleash or nadi-display sa bata. That is the reason why you feel like, no, the child is not adapting enough. Okay? And rest between battles. That is an important thing to do, no? Pag napagod ho, it's always okay to stop. No? That is also the reason why, no, I also do not force my children to study at all times, no. Pag pagod, no, I tell my children, okay, you're tired, sige, I will allow you rest. Let me know when is a good time, no, to study again, no. Why do I have to do that? Kasi po, siya yung magsasabi sa akin ng oras. Pag sinabi niya, galing sa kanya yun, therefore, he should be responsible for that. Okay? But I allow them rest in between. So that is also self-care. Okay? In your way, ikaw din mapapahinga. Eh, hindi pa siya ready. So why will I push? No? So that way, both of you will be taking care of each other. Okay? Next, take care of your body. No? Feed it well. Yan, hanggang dyan lang tayo eh. Feed it well. Yan ang kayang-kaya nating gawin. But please feed it well with nutritious food. No? Kids, adolescents, I really cannot stay long for my classes. I tend to take a lot of caffeine. be careful with that. If you are taking a lot of caffeine, have yourself evaluated. Baka kasi ADHD, no? Yung lack of focus. No? Those who take, especially po for adults, yung young adults, those who take a lot of coffee to enhance their attention, no? You can have yourself evaluated. Make sleep a sacred priority. No? Kahit paulit-ulit kong sinasabi yan, we all need our own doses of sleep. Hindi po pwedeng putol-putol. Ang teenagers ganon eh. 5 hours and then another 5 hours. No? It has to be at least straight. No? 7 to 9 for adults. At least no, a range of 9 to 11 for younger kids and even the adolescents. Okay? Ang hirap gawin, but it has to be a matter of discipline. No? Lights off for everyone, gadgets off for everyone. Move. Okay. Ma'am, we are in quarantine, yes. No, but find ways to move. Kung kailangan hong lagyan lahat yan ng pedometer, pakigawa. No? I ask all my children to wear fitness trackers, and they are required to give me an update how many steps they have walked before they can get their gadgets. Okay? And of course, find time to do physical activities. Mas masaya po if you do it together. No? So you walk with your children. If you have in the village, sometimes if we are kasi hassle paminsan lumalabas, we walk around, even in the backyard, or we play together. That is also a good way to do physical activities with your kids. Take care of your mind. Okay, our mind is a receptacle of a lot of thoughts. Therefore, practice thought awareness. How do you do that? Entertain only positive thoughts. Okay, once marami na po itong negative, then you tap yourself and remind, oops, this is not the way to go, especially for teenagers. It is not true. Merong generalization. They don't like me. My classmates no one loves me. Yan yung mga generalizations that are not very helpful. That is never true. Okay? Practice cognitive restructuring. Pag sinabi mo pong cognitive restructuring, it is trying to be mindful na ang tendencies mo, if you have a tendency to think on the negative, you try to restructure your thoughts to more positive ones. I failed my test. I am really a dum-dum. No. I fail a test because I thought it will be easy, so I did not study. So next time I will study better. That way you are practicing cognitive restructuring. Okay, meditate. Okay, kanina po we were given how it is to meditate. That is a good way of doing that. Slowly breathing in, breathing out. If you are stressed, if you are very anxious, that will help. That is the first one. Kanina rin, they told you to imagine yourself in a situation. That is an imagery. So that is also one way of doing it. Do what will work best for you. Okay. Another thing is to be kind to yourself and to others. It is very easy, to be unkind to other people. Think before you click. Lalo ho ngayon, we can have varying opinions about who will we vote for, who will support. It's enough that you express your support, but let's not mock the other people for the choices that they have decided. Yun kasi yung nakakadagdag. And then if you are kind to yourself, it's easier for you to be kind to other people. Most often than not, we are most harsh to ourselves. So do not be too harsh on yourself. Acknowledge that you are not perfect, that you can commit mistakes, but the most important thing is you can learn from those mistakes. And always practice gratitude. I always tell my patients, a lot of my patients tell me, Doktora, I don't feel like I wanted to end my life. no? How can you say that when there are a lot of people outside this room struggling for their life every day, no? So you have to tell them the very reason, no, that you are able to be with us. There is definitely a reason for it, and that is something to be thankful for, no? So long as you are alive, no, that is something that we should be grateful for, no? Because, no, kung titingnan mo po, there are a lot of women like us deprived of the chance, no, to be alive. So be thankful for it. Okay? Remember that your mind can be your most powerful ally or your worst enemy. Therefore, take care of it. If you entertain negative thoughts, you will feel negative about how you feel eventually. No? So try, no, to make your mind, no, a receptacle of positive thoughts and emotions. Okay? Structure your activities, no? Because the lack of activities, no, the lack of structure definitely affects the way we live our lives, no? Therefore, set realistic goals and timelines, but prepare for emergencies, no? If something bad happens, at least merong leeways, no? And then keep regular work hours. Yung regular work hours goes for both child, no, and you. Ang tendencies po ng bata, ng iba, lalo pag teenager, kung kailan deadline, no, doon gagawa ng mga projects. Do not allow them to do that. Let them feel. How do you feel when you are doing this? Kasi yung habits na yan ay makakalakihan eventually, no? So, you remind them to pace themselves, no? At kasi kung hindi naman pandemic, 'di ba? Nasa mas mahaba silang oras ng eskwelahan, no? That is the reason why things happen like that, no? Kaya nauubos, kaya ang feeling nila lalulunod sa requirements is because probably hindi nagagawa on time. Okay? And of course, balance your activities. Sabi nga nila, 'di ba? All work and no play makes Jack a dull boy. Pero hindi rin pwedeng all play, no? So you have to balance your activities as well. Okay? Develop warm and nurturing relationships. Again, I will highlight, no? Pre-pandemic, if the household is also already has a nurturing relationship, hindi siya mahihirapang mag-adapt dun sa pandemic, no? Therefore, be mindful, lalo na ho yung mga relationships that are quite shaky pre-pandemic, because they are the ones who will definitely struggle the more, no? So if you are an educator, ideally meron ka na pong listahan who are these students who might be having a difficult time, and probably reach out to them. At your own level, please do not forget to spend one-on-one time with each family member, kasi pag lahat sila sabay-sabay, they can be overwhelming. But also, do not forget to do things together. Make running the household a family affair. Assign each one a specific task, no? Sa amin ho, ang gumagawa ng grocery list yung 8-year-old kong anak, no? Dinidikta lang nung kanyang kuya. So yung husband ko, when he does the groceries, confused kasi minsan yung spelling, di niya alam yung bibilin niya. No? But you know, that is how it goes, no? So that everyone can contribute, no? That is how you should be doing it. Help your children to connect with their peers, no? Paano? Of course, because this is distant learning already, distance learning, no? Po pwede naman ho, okay, maybe do you want us to call your friend? Do you want us to have uh, meals together, pero papadala mo sa kanya yung provisions, no? Send provisions to people that matter, no? Lalo na po yung mga unexpected, no? They are really the ones, no, that make people happier, no? Lalo ho, no, if you know there are groups of people who tested positive, no, for COVID, send them provisions, no? Definitely it will warm their hearts, no, and know that they are not alone in their battles. And of course, do not hesitate to connect with your creativity. No? There is always something to learn. Surround yourself with beautiful things. No? You wear your clothes that makes you feel good. No? Kung kailangan magpabango, if you wanted to work better, do it. Okay? Help someone in need. If your lola is always asking, I told my son, no, please help your lola download a Spotify and make a playlist, no, so that, diba, that way you pass on, no, certain skills that they will be dependent on you. So that is one way, no. Also look out for each other, no. Kids, even your moms, no, can have a difficult time working from home, no. I am very happy each time my son, no, gives me water during my clinic hours, no. So you do that also to your parents as well, no. That is one way of looking out for each other. Do not hesitate to contract if at some time you feel overwhelmed, especially after your social media scrolling. Okay? There is such a thing as social media envy. Remember, children, remember, teenagers, that what you see in the internet is not always the truth. Okay? So do not be envious of people, because the tendency is for people to only see the better aspects of their life in social media, but we really do not know what is happening inside the home. Okay? And never hesitate to seek help when needed, no? Ang inyo pong mga magulang, no, ay hindi po manghuhula, no. We cannot know what is happening. Ay, doktora, I don't want to tell my mother because I think she will not understand me. How do you know? Did you express it, no? Probably now is the time. And parents, if your children come to you, please lend them an ear first, no? Ang tendency kasi natin, ano na naman? Bakit? No, what is happening, no? Stop, no? Try to allow them, no? So what, kasi po ang challenges nila are definitely different from the challenges that we have encountered, no? Ako nga, ang feeling ko baka nahirapan din akong mag-survive, no? If I were an adolescent at this age, no? I cannot definitely make a video of myself, no, singing or dancing. That will be a difficult one, no. So may mga inherent challenges ang bawat generation, no. So do not invalidate their fears by telling them nung panahon ko, no, kasi mafe-feel nila yon na invalidated sila, no. Nung panahon mo po, hindi po uso ang bullying, no, through GC. Ngayon possible yon, so mas mahirap yon i-deal with. Okay? So please, no, seek help when needed. Okay? And what if my resilience falters? Okay? What are the red flags that you need to watch out for? Okay? Feeling sad or withdrawn for more than 2 weeks, no? Highlighted po yung 2 weeks because, no, to feel sad for several days at a time, lalo na po when something goes wrong, is perfectly normal. Okay? But if you feel it for every day for the next 2 weeks nang wala naman pong identified stressor, then that is a warning sign. Seriously trying to harm oneself or making plans to do so, sudden overwhelming fear for no reason, sometimes with a racing breath, it can be a panic attack, intense worries or fears that get in the way of daily activities to the point that you cannot do anything, and involvement in many fights or desire to badly hurt others, or severe out of control behavior that can hurt oneself or others, no. These are warning signs. How about in school? School difficulties may also be a sign of emerging or unrecognized mental health problem. Poor attendance, particularly frequent absences, for vague or non-specific physical health problems. Masakit ang ulo. The other day, sumakit ang tiyan. Abangan mo po, baka sasakit na rin ang pilik mata. no? So, ang ibig kong sabihin, no, kung ang mga pains po ay hindi po interconnected, no, that is something that you have to watch out for. Okay? Difficulties with academic work, social integration, adjustment difficulties, problems with concentration, no, those are things that you need to worry or to observe. And of course, frequent cries for help on social media, no? Meron kaming mga ganyan, no, na actually doktora kaya ko lang po nalaman kasi nag-post po siya dun sa social media niya, no. I tell my children, no, I am allowing you to have your own social media provided that I am part of your loop, no. So kasi pagka po hindi ako part ng loop, ibig sabihin meron siyang gustong i-hide from me. I don't think that is a good one, no. Kaya lang po, parents, when you also make a decision for social media, you have to also be clear what is the purpose of that, no. Nakakakita po kasi ako ng mga bata 5 years old na merong mga social media accounts, no. So ang unang tanong doon di ba bago ka magka-Facebook account dapat 18 or up? So, how do you do that? Do you tell your children, I actually tampered with your age? So, paano yun? Conflict in values na yun agad. No? So, ano ba yung purpose? No? My son will tell me, Mom, is it okay if I will picture my shoes? What is the purpose? Okay? If you feel that you will just be showing off, I don't think that's a good reason to post it, no? So kailangan meron ding ganon, no? Para more or less clarified rin sila what is happening, no? Therefore, cries for help in social media, that is something that we need to watch out for. At pag sinabi na ho ng bata, no, na ako ho'y nahihirapan, no, ang ibang naririnig ko, kasi doktora, nag-iinarte lang, no? Let's try to understand first the context. Yes, frequently hurting herself, pero hindi naman po dangerous, no? Anong ibig sabihin nun, no? It means that your daughter is coping poorly, no, with whatever is happening, such that, no, he or she has resorted, no, to hurting himself or herself. So may problema, no, we need to address that one. Hindi po yun pag-iinarte lang, no. Pangit kaya yung may peklat pag ikay teenager, 'di ba? So ayaw mo rin na sinasaktan yung sarili mo. Unfortunately, that is the way they have learned to cope. So we listen to that. Okay? And as I end, no, my presentation, no, if you have forgotten every concept that I have told you, ito lang po ang pwede ninyong tandaan. There is no way at all to beat someone who is raised with love, no. I always tell my children, you are loved, no, and that you should never allow people to think, no, that you will never amount to something. Okay? So always, no, love your children and express, no, that they are loved and that they are valued in whatever form that they come. So good afternoon na ba? And thank you very much, no, for listening to this discussion. Thank you.